What was it about sick leave and about this idea that perhaps we could provide something if we got into the care earlier that you remember way back from the very beginning was most intriguing to you? Or what did you see that was a frustration that you thought, boy, this could be improved, that kind of really was the catalyst that pushed you toward that direction?
Well, we saw that many patients never came to physiotherapists, that they would come for their back pain or their knee pain, and they would get medication, and maybe they'd get a sick note for a couple of weeks, and then they'd come back and say, oh, we're not better, and maybe they get a new sick note for another couple of weeks, and then after a while they'd come to a point where the doctor felt that, oh, this is not getting better, now we should send them to the physiotherapist. But that was just too late. And there was so much more we could do, that they could see that the patients saw themselves as sicker than they had to be. And it was hard. If you've been at home with back pain for a month, it's not the same thing. If somebody says, yeah, now you have to start moving, you have to start doing exercises. And if you had started it after a few days, you're more receptive to it. And the earlier we came in, because occasionally we did get our patients and we thought we should, and it worked much better. And we tried it, sort of more inefficiently, like that, try to get the nurses to send patients to us directly. And a few were interested and a few would do it. And those were very, very good experiences. The patients got the help they need right away, but everyone wasn't doing it. To get it to work properly, we wanted all patients who were seeking for this kind of problem to have that opportunity to come to a physiotherapist first. And then some of them need medication, some of them need their sick notes, but one can always organize that afterwards, because they're quite, the patients will be quite, motivated to get their medication. If they think they want medicine, then they'll see to it that they get medicine. Whereas they're not always as motivated to do their training and start exercising. And so you have to have that as a sort of a precondition that if you want to get better, this is the basic treatment. And then medication, that's extra if you need it.
Hear the entire episode for free on iTunes, Spotify, other favorite podcast players, or go to mechanicalcareforum.com.